guy I'm supposed to be talking about?
It's Jonathan White, Dr. Scalpel. Remember? We talked about this. You're introducing him.
What was it he did again?
He was selected as a 3M National Teaching Fellow this year.
Is that a big deal?
I think so. I heard he was the first surgeon ever to do it.
So what's he like?
Well, let's ask some of the people he works with.
A very small proportion of people who end up coming to the attention of a surgeon.
His passion for what he does is contagious, and when you're around him, you can't help but want to learn and grow and become involved with what he does.
I was born in Belfast, Northern Ireland, grew up there. I got into medical school. Whenever I worked in surgery, I decided that this was where the main impact was. Like, people came in sick and you operated on them and they got better, and that was very gratifying. The reason why I got interested in teaching was I started to get interested in what was happening to me. Like, there was a point at which I didn't know anything about surgery and I was a complete novice. And you fast forward to today, apparently I'm an expert. Apparently people look at me and think I know what I'm doing, but I'm not quite sure what happened to me to get from A to B, right? So I'm actually quite interested in what happened to me, and can we do it better actually? Like, is there a better way?
The culture of surgery is one that we'll say, is somewhat resistant to change. And the fact that he has found new and innovative ways to reach medical students and reach residents and is really changing the way that we're thinking about surgical education.
And you got to come into frame. I've done a bunch of different things in my career, and I've done lots of different education things, and I've published a whole bunch of papers as well. But probably the Muppets is the thing that's really captured the imagination.
Look, we have a shiny new med student on our team today. Look! Did you meet yet?
Patients are saying to me, hey, you didn't bring your Muppet in today to help with the surgery, So it's really been astonishing, and there's something about a puppet that lets you engage with people in a way that you can't do for yourself.
We went to the Canadian Conference of Medical Education a few weeks ago, and the Ottawa conference was also going on at the same time, which is medical schools from all over the world. And people were coming up to him and saying that they use his podcasts when they teach, and they knew of him, and it was amazing how far his reach extended beyond just the University of Alberta.
The fact that he is the first surgeon to ever win this award really speaks to how innovative he is.
He wants everybody to succeed. He wants you to challenge yourself. He wants you to learn everything you can and take something away from every experience.
I actually don't think I'm that good a teacher. Like, I think there are other people who are better teachers than me. But I'm probably the guy who thinks the most about it and wonders the most about it and tries the most newest things and maybe works the hardest at it. And I make up for my lack of natural talent by hard work. A lot of the time, I'm just following where the students are leading, right? They're the ones who are using the iPhone and using Google and using Facebook and stuff. And they're also the ones who are kind of telling me what's really happening when they're learning about surgery and helping me to make videos. They're the ones who are teaching me.
That was pretty cool.
Yep. Although, that thing with the Muppets is kind of baloney. They didn't even look like us.